Prenatal and postnatal health, a journey of two lives. Bringing a new life into the world is one of the most extraordinary journeys a human body can undertake, and it's a journey that deserves care, knowledge, and support at every step. Whether you're expecting your first child, planning a pregnancy, or holding your newborn for the very first time, understanding prenatal and postnatal health isn't just beneficial, it's essential. In this comprehensive guide, we'll walk through every key aspect of health before and after birth, from nutrition and screening to mental well-being and recovery, equipping you with the science-backed, compassionate insights you need to thrive during one of life's most transformative stages. Part 1. The Foundations of Prenatal Health. What is prenatal health and why it matters? Prenatal health refers to the care and attention given to the mother and developing baby during pregnancy. This isn't just about avoiding risks, it's about actively building health for both. Studies show that a mother's physical, emotional, and nutritional state during pregnancy profoundly affects her baby's development, not only at birth, but throughout their life. Proper prenatal care reduces the risk of complications such as preterm birth, low birth weight, gestational diabetes, and even long-term chronic illnesses in the child. It's preventive medicine in its purest, most powerful form. 2. Prenatal nutrition. You're not eating for two, you're building for two. Forget the myth of eating for two. The truth is more nuanced and more important. A pregnant body needs nutrient density, not calorie surplus. Key nutrients include folic acid, prevents neural tube defects, ideally started at least 3 months before conception. Iron, supports blood volume expansion and fetal growth. Calcium and vitamin D, critical for bone development. Choline, often overlooked, but vital for brain development. Omega-3 fatty acids, DHA, support fetal brain and retina development. Whole foods, clean proteins, leafy greens, legumes, nuts, and quality prenatal vitamins are the foundation. 3. Regular checkups and screening. Prenatal care involves a timeline of regular checkups to monitor both mother and baby. These appointments help track baby's growth and heartbeat, monitor maternal blood pressure and weight, detect gestational diabetes or preeclampsia early, offer ultrasounds to assess fetal development, offer vaccinations like Tdap and flu to protect the newborn, screen for chromosomal or genetic conditions if appropriate. Think of these visits not as appointments, but as milestones, each one building safety and connection. 4. Movement and mindfulness. Gone are the days when pregnant women were told to rest constantly. Moderate exercise during pregnancy is not only safe, it's beneficial. It can reduce back pain, gestational diabetes risk, constipation, fatigue and mood swings, labor duration. Prenatal yoga, swimming, walking, and light strength training under professional guidance are ideal. Pair this with daily mindfulness practices like breathing, meditation, or journaling to calm the nervous system and prepare for labor. The mother's mental state directly shapes the environment in which the baby is developing, emotionally and biologically. 5. Sleep and stress, the silent architects. Poor sleep and unmanaged stress during pregnancy are linked to higher risks of complications and mood disorders postpartum. Prioritize a consistent bedtime, cooling the room, body pillows for support, digital detox before bed, counseling, therapy, or support groups if anxiety rises. The mother's mental state directly shapes the environment in which the baby is developing, emotionally and biologically. Part 2. The Labor of Love, Preparing for Birth. 6. Birth planning with flexibility. Whether you dream of a natural birth at home or a scheduled C-section in the hospital, the goal remains the same: a safe delivery. A birth plan should include preferred location, pain management choices, who will be present, breastfeeding intentions, cord cutting, and skin-to-skin preferences. But plans must remain flexible. Birth is powerful and unpredictable. A good plan guides, it doesn't control. 7. Signs of labor and when to go. Knowing the difference between Braxton Hicks contractions or practice contractions and true labor is key. True labor involves regular intensifying contractions, lower back and abdominal pressure, water breaking, though not always, bloody show. Always consult your care team about when to head to the hospital or birthing center. First-time parents, don't hesitate. False alarms are better than risks. Part 3. Postnatal Health, the Fourth Trimester. 8. Physical recovery, one day at a time. The body undergoes massive changes during delivery, whether vaginal or cesarean. Recovery often includes uterine contractions and bleeding, perineal soreness or stitches, breast engorgement and milk production, hormonal shifts, sleep deprivation, hydration, rest, pelvic floor exercises, and gentle movement help the body heal. So does patience and compassion for yourself. There's no rush. Healing isn't a race. 9. Mental and emotional health. This is the most underestimated part of postnatal care. Up to 1 in 7 mothers experiences postpartum depression, PPD. Common feelings include guilt, sadness, irritability, feeling overwhelmed, difficulty bonding with the baby. This is not weakness. It's a medical condition that needs treatment. Never hesitate to speak up. Therapy, support groups, and sometimes medication can be life-changing and even life-saving. 10. Nutrition for recovery and breastfeeding. Breastfeeding mothers need an extra 300 to 500 calories per day, but again, it's quality, not quantity. Focus on iron-rich foods to replenish lost blood, hydrating soups and broths, omega-3s for brain recovery, lactation-supportive foods like oats, fennel, and fenugreek. Breastfeeding is natural but not always easy, so don't be afraid to ask for lactation support. And if you choose not to breastfeed, that's okay too. A healthy baby starts with a healthy, supported mom. 11. Sleep and routines in the newborn phase. Newborns don't sleep on adult schedules, and that's biologically normal. But you can protect your sanity by sharing nighttime duties, napping when the baby naps, limiting visitors, saying yes to help, meals, chores, errands, practicing safe sleep, back to sleep, firm surface, no loose items. And remember, this phase is short, exhausting, yes, but it doesn't last forever. Part 4. Partner and family support. 12. Involving partners in the process. Partners aren't bystanders, they are co-pilots. During pregnancy and postpartum, they can attend checkups, learn about baby care, help manage chores and meals, monitor maternal mood and recovery, offer emotional support during labor and postpartum. Studies show that involved partners improve maternal outcomes and reduce postpartum stress. 13. Managing expectations and boundaries. Culturally, many new families face unsolicited advice, comparison, or pressure. Protect your space. Set clear visiting rules. Prioritize bonding time. Say no to guilt. Trust your instinct. You know your baby best. This is your family's sacred chapter. Let your values, not others' opinions, guide you. Part 5. Final thoughts. A lifelong journey begins. Your body is brave. Your heart is wiser than you think it is. Pregnancy and postpartum are not just biological transitions, they are emotional transformations. They make us confront fear, vulnerability, love, and identity. No path is perfect, but every path deserves support, understanding, and grace. Whether you're reading this with a growing belly or a newborn on your chest, take this as your reminder that you are doing better than you think you are. Every stretch mark, every sleepless night, every quiet tear, and every joyful giggle, they all belong to a beautiful, powerful story of becoming. And that story deserves to be celebrated, not just endured. Stay informed, stay supported, and above all, stay kind to yourself. Because prenatal and postnatal health isn't just about surviving, it's about thriving together.